Welcome back to I'm African podcast. I'm your host, Liz, and today we have another yet interesting topic. We are talking about mental health. Africans and mental health. This is scary. My friend thought I was crazy because I will offend a lot of African pastors talking about mental health because why should we talk about mental health when we have God and we can just pray or just keep going? So today we decided to sit down with our special guest who is going to introduce herself very soon and we're going to have a conversation on mental health. So, welcome.
Thank you.
Thank you so much for coming here today.
I appreciate it. I'm very happy to be here.
Can you
Thank
tell us a little bit about yourself?
Yeah, sure. So I'm Dr. Osamor. My first name is Paulette Osamor, Dr. Osamor. I am a psychiatrist trained. I born and raised in Houston, I'm Nigerian American, first generation, and I went to college in Houston. I went to medical school, kind of close to Houston, Galveston, did residency in Austin and a little bit of training in San Antonio. And I've been practicing since last summer. And so, yeah, I'm really happy to be here and I'm really passionate about this topic. So thank you for having me.
Of course, thank you. And I realized like I've ran into you before in Austin, because of UIU.
Oh, really?
Yeah, because I had friends. I think it was in 2021 or something.
Whoa, okay. That must have been when I first moved out to Austin.
Okay. But I remembered like when I saw your face when you got here, I was like, oh my God, I've seen this face before.
Yeah, okay,
but,
awesome.
Yeah, thank you so much for coming, and we're going to get into the topic, right?
Yeah,
I have some questions here
sure.
for you. For me, as someone who's Congolese, right? I've seen mental health being something that was not talked about, right? It's either you are silent or you are told to keep going, you're told to pray. They turn into a lot of different things, but having conversation about mental health. So my first question for you is, as someone of Nigerian descent, you were raised in Houston. There's a huge African community here, right?
Sure.
Did you notice differences between mental health, like how mental health is viewed within African like household versus like the wider American culture?
Yeah. So thank you for that question. And I think it's a great one to start off with. And I say that because being born in the US and being first generation Nigerian American, you kind of get both aspects of it. Being born here creates its own culture and ideas about mental health. And then also having parents that immigrated from Nigeria to the US has that part too. And so I grow up with some of the American ideas and culture and perspective, but also the Nigerian culture and perspective, because that was what I was, taught in home. Yeah. And so, I think for me, I definitely can say it wasn't something that was discussed. Being a child growing up, it's not something like I wouldn't think about these questions. When I was younger, I didn't know I was going to be a doctor. I didn't know I was going to be in psychiatry. So a lot of this is in hindsight and kind of looking back. And so some of the things I do notice is that, it's not something that I feel was really discussed in general. And I can use my personal situation. I was diagnosed with ADHD, but I wasn't diagnosed until my first year of residency. Wow. But looking back, I had pretty much all of the symptoms that we would, diagnose someone with ADHD. But those weren't things that were mentioned back then, not by teachers, not by my parents, not by like just people in the community when I was at church. But I had all the, some trouble focusing, trouble remembering things. I was very much so a very outspoken kid. And so a lot of the behaviors that I exhibited were attributed to kind of being oppositional. And so with that comes discipline, which is a big thing. And so struggling in different ways, especially in a Nigerian household, came with things that, were really heavy on discipline. And it wasn't things that they understood, my parents. I think the other part of it is mental health as children, at least back then, more recognized in just Black in general, non-Black, children. So even to go as far as including African children as well, or children from African backgrounds. And that extends into schools. And so non-Black children, non-African children, mostly white American kids, they would have some of these symptoms recognized, and they would also get what they needed versus it was looked at something else. And so I think that's how it kind of started for me. Things that I can think back now and say, oh, even in childhood, this was evident. And again, it's not, anyone to necessarily blame, but it is something that I think it's something that I think that should be discussed, and something that we should really take into account, the different cultural aspects and how they view mental health. So yeah.
Thank you.
Yeah.
Thank you. That's actually great.
Yeah.
Your response is actually great. You brought up some great points, right? Bringing up like ADHD. There's a lot of Africans that probably should, get tested. And there's children, and a lot of parents, when children are misbehaving or they're not really paying attention or doing the things that they're supposed to do, they go immediately to disciplining the child, right?
Yes.
They never try to pay attention to possibly understand why that child's behavior is that way.
Exactly.
And you saying that, brought back some memories. And I have a brother who's dyslexic, right? It was a white family friend that came and recommended that we get my brother checked out. And most of it was it was the reaction from the African community, at least Congolese community, was, oh, this child was possessed. They always try to connect it to, oh, someone prayed against me, or there was someone had witchcraft against me, and that's why this child is behaving this way, or this child is born with a disability. Yeah. But they never try to really think about the fact that, hey, maybe we need to get a specialist to take a look at this child and maybe try to see maybe there's more to it.
For sure.
Than that, definitely. Those things. Thank you so much for sharing that.
For sure.
And thank you for touching into your personal story.
Yeah.
That was very touching.
I think it's one thing to read about these things, to study it. Obviously went to med school, did psychiatry residency, but it's another thing to have the perspective from living through some of it, which I think has really helped to be able to recognize it in other communities and other people and people that are like me. So, but yeah,
definitely. Thank you. Oh yeah. Another question. This one is touching the emotions, right? This question is, in many African families, emotional struggles are often described as spiritual, disciplinary, or simply part of life, right? Yeah. How do we begin separating cultural beliefs from situation where professional mental health support is actually needed?
Yeah. So I think this question is a great question. I think it's a little bit complicated because it's, first of all, when you think of cultural beliefs, like what goes into that, right? What goes into culture? We're talking about customs, values. We're talking about religion, right? We're talking about language. We're talking about all these aspects that make up culture and so much more. That in itself, even when you break it down, things can be different, right? And so I give the example of religion. Yeah. Religion and feeling a certain way, let's just take depression. A lot of people, let's say, praying, seeing that helps. And so it's that. And then you have language. Yeah. Language. And one thing I'll say is like language barrier. A lot of things don't even translate into certain languages. Yeah. And so, for instance, we're recommended in medicine to use translators because we know that there's a lot of words that we use, especially in psychiatry, that there's not a word for it in specific languages. Yeah. And so it's like, how do you describe psychosis in Spanish, right? Or what does that sound like? What does that look like? And then the values, right? And some of that really is where we start from. And then how to separate that from really not necessarily separating it. I think it's not necessary to separate it from a foundational standpoint, but from a seeking treatment standpoint is where it comes in. It's nothing in life is black and white. There's no and or. So there is, and oftentimes as a mental health specialist, I recommend multiple sources of support. Religion is one for a lot of people, which I would never want someone to dismiss, right? Yeah. Community is one for a lot of people. I would never want them to dismiss. Culture, even things like music, things that can be very therapeutic. Yeah. But I think I think where the barrier comes in is the stigma associated with it. I think even talking about it. And then I think the other part is seeking help. And with religion, going as far as to believing only higher powers can really heal you. Yeah. And then medication, right, is the other part of it. So I think there's so many aspects of that. But I think the underlying issue is stigma. People being uncomfortable to talk about these things. Really, people don't like change. Doing things the same way that they've done, right? And that includes how they grew up. We can't discount how our parents and our grandparents grew up. Yeah. Whether they were experiencing things like depression, the responses that they may have gotten, how they were taught, or how they were expected to deal with their problems are going to be passed down to us. And so I think there's a lot of crossover that it's really hard to think of it just from a bigger picture aspect. I'm like, it's one thing, it's several things that go into it.
Oh, yeah.
So I think starting there is really important.
That's great. That's actually another part of like something that you mentioned. We actually sat down with a pastor and we talked about the hustle culture, right? And I was curious because I knew that we were going to have this conversation.
Yeah.
And I wanted to get his opinion on like mental health with people using religion as like a reason for why they don't want to talk about mental health or consider mental health and like the help. And his response was very interesting. So people will have to go watch the episode on hustle culture because we do address that. But it was very interesting to see that, like, from a religious leader, what their perception is on this whole topic. And it's going to surprise a lot of people because with us Africans, we feel like, oh, just praying about it. I see it a lot in the Congolese community, right? You will be feeling down on like, you are clearly depressed. You're dealing with loss. People are always like, just pray about it or just be strong. You can only be strong so long, like for so long. Yeah. You can only pray so much. God gives you a lot of resources.
Yeah, exactly. And having access to those resources is also a blessing.
Exactly. So, and why not leverage those resources and actually take care of yourself? No one is saying don't pray. Yeah. Right? You can pray and go to therapy. A lot of people do it and it actually works.
Exactly. It's not a black and white thing. It's a lot of times multiple things coming together to support that person is necessary. So I agree.
Yeah. Thank you so much for that.
For sure.
So my next question is, a lot of African children are raised with a survival focused mindset, right? Success, resilience, sacrifice. Do you think emotional well-being is sometimes overlooked in the process?
Definitely. That one, very much so. Our parents and their parents, whether you're first generation or if you're also, were born in an African country, they came from a lot of places and times where that was their priority at the time was survival. And so survival, when you think of the hierarchy of needs at the bottom, is the primary things that people need to survive: food, shelter, water, clothes. And that was how it was for a lot of people back then. And so being able to obtain those things, people would say that it's, to be grateful for that. And so anything that's after that is really, what if you don't, you didn't have this, or be grateful for this, and be grateful that there's a lot of comparing. Be grateful, I'm sorry, that you have, a roof over your head, or you have clothes to wear, you have food to eat and water to eat. And I think another thing is also not having room to address those emotional barriers or emotional needs because of that survival. And so when we are experiencing our own emotions and we're experiencing our own challenges with mental health, a lot of times we are reminded by our parents or by the community about their struggles and how at that time when they were younger, that was their worry was. And so because we have all those things, it's almost like, well, why are you depressed if you have all those things? Why are you still depressed if you have a roof over your shoulder, or your head? And then why are you sad if, you have, food to eat? And even so, you have money to do the things that you need to do, you're not stuff. So it's that question of, where's that source of sadness coming from when you have all those basic needs and more met? And so I think, that's one thing to really consider is, there's reasons and then there's not reasons, especially for something like depression. A lot of times people are depressed for no reason. And a lot of it is multifactorial, right? There's the science behind it, just different chemicals in the brain that cause that, environmental things, relationships, psychosocial factors that aren't based on primary needs, how people are doing in school. We talked about, a lot of resilience. Resilience to me and strength is different. I think resilience is something you look back on and say, wow, I was strong during that time, which I think is a great trait to have. I think strength is more of a active form of when you're going through something and being able to handle it. And I think people associate being strong with doing things on your own or not relying on certain things. And so redefining what strength looks like. And then not only, especially in our community, having to rely on that aspect of us being strong, because that's what we've been known to do and known to be traditionally. And so I would say, again, lots of factors, and I can probably go on and on about this topic. But I think starting there, and really deconstructing some of the ideas of what strength, resilience looks like in across cultural, different cultures. And so, I would say, that would be something that I would consider first.
I like all the information you're sharing, right? Like I'm learning so much from sitting here, but also like I can see the things that you point out because a lot of us live through it, right? Like, a lot of Africans, a lot of people, Black people live through these things. And you're not the first person to say how our parents have grown up differently. They lived a different life. They've experienced life a little bit different. And something that I have heard that a lot, right? And for me personally, I've struggled in some aspects because in my household, they didn't raise us to be able to talk about our feelings.
Exactly.
And when you're going through something and you want to talk to your parents about that situation, and you already know what they're going to tell you, you'll be strong. You should be grateful. Imagine you have all these successes and all those things. What are you complaining about?
Exactly.
So when you're struggling and you already know that would be their response, then what do?
Yeah.
You just deal with it and you try to figure it out on your own with your struggles. So we hear a lot of that. But there were times I used to think that was an excuse, right? Thinking about, oh, they lived this life or they've gone through this and they deal with this. I used to think it was an excuse from African parents sometimes because they don't want to go out of their regular, traditions or their beliefs and learn something new and make it normal for us to be able to have these emotional conversations stuff. But I can also understand the language barrier and all the other factors that come with it, right?
Yeah.
It's difficult for them to even sit down and to know where to start.
Exactly.
And so I do agree with that. So my next question is, has to do with community. You mentioned community earlier, and you have emphasized, the importance of community when treating patients, right? In many African cultures, community can be both a source of support or pressure.
Yeah.
How does community impact emotional well-being in our communities?
Man, honestly, and thank you for that question. I think it's one of the most important factors when you think about outcomes and well-being of someone who is struggling. I always tell people, in my opinion, human beings are not meant to be alone. We're social beings. We really can't do anything without other humans if we think about it. Like, I know the idea of some people are on their own, but really we rely on other people for multiple things, and that's also emotional needs. It is one of the most important things, not even from just a subjective standpoint, but studies have shown, I'm going to make an example, the single most positive predictor for someone with schizophrenia, which is a psychotic disorder, for them to have the best outcome is community support. More so than any medication, more so than any other treatment or management is community support. Individuals with schizophrenia that have community support, parental, sisters, brothers, friends, they do a lot better long-term than those without. And that is, again, more so than any other factor, including medications. And so I just highlight that to show you how strong and important that is. I think the flip side of it, again, the negative side is really, if you're a part of some of these same communities where your parents, friends grew up with, or from the same cultural background, then it can kind of transfer, those ideas. Community, a lot of times are communities for a reason. They think alike, right? I kind of almost call it like herd thinking. Like, they think alike, they have similar cultures. That's why they form communities. And so it can be that way, or it can be negative in that way, just because if you are seeking help and you're going to your community, but everyone is having the same response or a very similar idea to how things should be done, how things should be addressed, it can feel like you're trapped.
Yeah.
Right. And then also, I think can be detrimental because we don't know what we don't know, right? If we are going to people in our community and they're telling us the same things, then we might just assume that's how it is and this is how it should be addressed, even though we're questioning ourselves or why are we still struggling?
Yeah.
But, everyone in my community is saying this is how something should be addressed. And so I don't know anything outside of that. And so that's why education is very important. Seeking out information is very important, but it's challenging. And so I think it can help. It's like a double-edged sword. Like, it can help, but it can also be harmful depending on, what comprises of your community. And so I think it's very important. to always advocate for yourself. We grew up in African households. We were taught not to question things.
Yeah.
And if we did question things, that was a source of discipline.
Yeah.
And so, but I think that is something that becomes detrimental. And so I think in order to do that, everyone should be doing that for themselves.
Yeah.
And so I think that's something that individuals are gonna need to do in order to really get the answers for themselves. Because at the end of the day, it is yourself, and you are trying to feel better, and you need to do whatever you can to get to where you need to be.
Yeah, absolutely. Right? Absolutely. So, and I see that, like, in a lot of African communities, right, we depend on community. Mm-hmm. There's community parenting.
Yes.
There's you need that community. You need those people that understand you or think like you sometimes, right? To be able to help you. But no one thinks about the negative, aspect of it. And a lot of us, we feel comfortable being in those spaces. But if there's lack of education and lack of knowledge and experience, then it's working against us to some capacity. So that was really nice.
One thing I'll also say is the good part, or I think a good part about having this, or turning something that's potentially negative into positive, is that as we grow older, as we venture out, a lot of us go to university, we go study, so we're getting exposure. Even in high school, it can start. We're getting exposure to different cultures, different people, and then as we get older, we get more insight. We start to form our own perspective, including our cultural upbringing. But then we use that and other aspects of what we learn to kind of form who we are and how we think. One thing that I've noticed is that as an adult, and going back and having these conversations with my parents, having these conversations with my mom, stuff that they are able to kind of recognize now, not only in me in terms of, but stuff in themselves that they wouldn't have maybe considered to be issues back then because of that. So it's also a learning opportunity. And again, it's something, it's at the detriment in the beginning, but it's something that can come, or something comes from it that's positive like that. You're not only learning for yourself, but you're teaching those around you through that, and by being an example. So,
And that's something that we try to encourage on this podcast, right? We having this conversation. Some people find them very uncomfortable to have. And we created this podcast and this space so that people can feel comfortable going and having this conversation. And something that I always say to our audience is use this as a conversation starter. Exactly. It doesn't have to be about you. You can talk about somebody else. Most African parents, you can be telling them a story about someone else, and they will pay attention, and they will be able to see things that they'll probably won't see if you telling them that it's about you. So we try to encourage that a lot. So our last question.
Yes.
I know. I wanted this to keep going. I was like, do we have more questions? But you have been such a great resource.
Thank you. I appreciate
we really appreciate you coming here. So for the last question, for Africans listening, right, who may still feel hesitant about therapy or mental health support, what is one thing you wish our communities understood better? And also, what is your recommendation for them?
Yeah. And so I think, I'll take the first part. One thing that our community would understand better, I want to say, and I want to highlight some of the progress that's been made, though. Even in our communities, the diaspora, the African diaspora is huge. We're all over the world. And so there has, and I believe to be positive progress towards recognizing these things. So not only in the diaspora, but also in some of the African countries. Now, we still have a long way to go, but it is important to highlight that mental health is becoming something that more people are having conversations about. And so, and in those communities. And so I think as more people have conversations about these things, as more things are more evident, that a lot of factors in life that are external, that are like what we control, are things that we are susceptible to. And so I think that's another thing with community and with culture. A lot of times we blame ourselves for our shortcomings, and we don't consider the external factors. And so I think the community having these conversations is one thing, coming together to discuss these things, being open about it. You mentioned earlier, a lot of people are uncomfortable. I have a saying that I always remind myself that it's important to be uncomfortable. Being uncomfortable, you have to experience it. And so Because if you can't, or if you don't, then that doesn't lead to change. It doesn't lead to these kind of conversations. And it's okay to be uncomfortable for that time period. That way you can kind of pave the way for people behind you to be able to have these conversations and feel more comfortable as the generations come. And so I think that's one thing I want community to understand is there's multiple ways of doing things. I'm not saying to discount things like religion, language, all of the aspects of culture, but that we can use those tools to come together with other resources that we have that are not so traditional or thought of to be traditional of what was used back then to really, to help people and helping individuals, in my opinion, creates a sense of bettering the community as well, because when one individual is doing better, then the community does better. And so I think that's what I would say. And then an example I have is, a lot of churches and pastors have come together and are working with the mental health specialists to create that, right? Create that safe space of acknowledging some of the things that we would want to attribute to personal characteristics and flaws, but creating that space and using culture and their religion and to have that foundation, but also inviting us into the conversation. And these weren't things that were done 20, 30 years ago. And so it's already happening and just continuing on that and building on that. And so I think, understanding all the things that go into it, being open-minded, and being uncomfortable is something that, would help with that conversation.
I actually have something that I wanted to ask you before we end this.
Okay.
And it's a lot of pressure that, you were like Nigerian, of Nigerian descent, you're a woman, and there's this stigma. I don't want to call it a stigma. There's this conversation around the eldest daughters in African households, right? And the pressure that they carry and how they deal with it. Because I have conversations with my friends and who are female, and they're usually the older daughters in their household. And we feel this pressure of being the second moms in their household. And there's a lot of us out there that carry the role, right? But we sometimes just deal with that pressure and not really go and try to find ways to address it. And my friends and I have conversations about it. But what do you recommend for the older daughters, like older daughters in their families, and like some resources that can help them navigate those things? Because it is a lot of pressure that I see a lot.
For sure. I think to highlight some of what the underlying issues may be, I think the idea of the eldest daughter, you kind of set the tone, right? Or at least that's the thought for most of our parents. They kind of set the tone. You're the first daughter, you're the older, the wisdom. So a lot of those beliefs are cultural as well. But, I think one of the things is the idea of what parenting looks like and what it should look like is addressing that, having that conversation, feeling confident to have that conversation with your parents. I think even being okay with getting some pushback, being okay with at some points coming off like you're being a disrespectful child. I'm not saying that we should, but we have to challenge these things, because at the end of the day, it's you. And I think starting the conversation with the parents, I think a lot of people don't start that conversation with their parent. And so they internalize a lot of that. And then they just kind of hold on to some of that anger and resentment, and becomes resentment. And so I think having the conversation with, an open conversation, right, with your parents, and kind of expressing how you feel about it. And then I think community in multiple ways, right? And so you're, lots of first daughters out there. And so having this, continuing to have this conversation amongst you guys. And then I think also seeking therapy. I know that might sound like a cliche thing, but I think it's helpful to speak with someone who does not know you, who may be even from a different culture from you, and don't have those same kind of expectations, that's trained to kind of listen to both sides, listen to what you have to say, and provide perspective. And then to also help assist you to get where you need to be, feeling more confident about expressing yourself, and you're expressing, the idea that you don't feel like that's your role, being comfortable in who you are and continuing to be who you are. But also at the same time, still trying to keep that fellowship in that family, right? Telling, it's hard to want to do. You don't want to cut people off. A lot of times too, you go to someone and they become defensive, and the first thing is like, okay, now they're on the defense, and now it's like this against that. We don't want that either. And so it's combining all of that, being confident, being conservative, but still maintaining that community and that sense of the importance in family. And so I would say that would be like where I would start with that.
Okay. Thank you.
Yeah, of course.
That was helpful for me. And I know it's going to be helpful for a lot of oldest daughters out there. I had to take one for the team here, But thank you so much.
Sure.
It's been a really great conversation. We really appreciate you sharing your experience, sharing all this advice and your perspective on things. It is going to be interesting to see what our audience has to say. And it is mental health, Africans and mental health. So thank you so much for joining us. We really appreciate your time here. And everyone watching, once again, use this as a way to start conversation within your families, with your friends. And thank you for tuning in. This is I'm African podcast. Let us know what you think. I'm your host, Liz, and we'll see you next time.